Hello and welcome, everyone. I'm Colleen Ferris, Director of Innovations and Strategic Development at Healthcare Excellence Canada, and I'm pleased to be your host today. Great to see so many of you, as I know this is one of many webinars that we've been together on. Healthcare Excellence Canada is an organization launched in 2021 with a relentless focus on improving healthcare with and for everyone in Canada. I'd like to start by acknowledging that we are meeting on land that has been inhabited for generations. In particular, I acknowledge that I'm hosting this webinar from Ottawa, Ontario, the traditional territory of the Algonquin people. As we get started, we invite you to share your introduction and land acknowledgement in the chat. Please note that this session is being recorded, and we are pleased to offer French simultaneous interpretation for this session. Please select French from the interpretation menu at the bottom of your screen to listen to the French audio. If you need support at any time during this webinar, you can reach out to tech support using the chat feature. English participants may choose to view the auto-generated live transcripts or subtitles throughout today's session by clicking the CC Show Captions button from the Zoom menu at the bottom of your screen. French subtitles, unfortunately, cannot be viewed live, but we are pleased to make both English and French captions available on the session's recording. Again, for those of you just joining, I'm Colleen Ferris. Also joining today are my colleagues and challenge leads, Bill Callery and Meg Sabian, as well as a great team behind the scenes helping ensure everything today runs smoothly and successful. So thank you to Sheena Sherwood, Gina Peck, and Esther Lowell. Today's session has been designed to help prepare the teams for the upcoming Senior Leadership Engagement Mini Challenge, where teams have the opportunity to develop an engagement plan and submit it for a chance to win an award of $5,000. We have some excellent presenters who will walk us through this virtual workshop style session, where we'll be taking an in-depth look at measurement of return on investment related to retention strategies, and how to use this information to engage senior leadership in support of the success and sustainability of your initiatives. So we are pleased to be joined by two special guests today, Raylyn Douglas, CEO of Ray Soleil Consulting, and Suzanne Schell, CEO of the ROI Institute Canada. Raylyn brings with her over 20 years of experience leading large-scale transformation change initiatives within the Saskatchewan Ministry of Finance. And Suzanne, as the Canadian partner for the ROI Institute, has been successful in bringing the ROI methodology to healthcare organizations, hospitals, and systems across the country. Today's session will deliver content and share tools for effective strategies to engaging senior leadership in change initiatives aimed at supporting and retaining the workforce. There will be time for open Q&A throughout today's virtual session, leaving space for you to ask questions and receive support from staff, as well as Raylyn and Suzanne, to ensure you're feeling supported as we head into the second half of the challenge. We'll leave some time towards the end also to review some of the upcoming award opportunities, coaching supports, and other updates to watch for in your email. I'm also pleased to welcome many of the challenge coaches, as well as judges that have and continue to support the review and scoring process for submissions received for each of the award opportunities. A reminder that HEC is not doing this program alone. We have a number of supporting organizations. These organizations help with promotion, marketing, judging, coaching, and curriculum. They play a critical role in our outreach by sharing this challenge amongst their networks, and also work closely with us in delivering this challenge by participating in many ways. And we now have 17 supporting organizations, with Canada Health Infoway having just recently joined. And as of December 21st, 2023, still having a hard time saying 2024, but in December 2023, we have a total of 126 teams registered, with teams registered from each of the provinces from BC to Newfoundland and across sectors, including hospital, long-term care, primary and community-based care, and mental health teams. As teams continue to register until the end of April, we will continue to recruit more targetedly for teams. Now, without any further delay, I'd like to welcome and hand it over to our guest speakers today. So over to you, Suzanne and Raylyn.
Good morning, everyone. Raylan Douglas here. Can you hear me okay? Okay,
I
terrific.
think fine, yes.
So Suzanne and I have turned on our cameras. There's a lot of people online, so it's great to see the representation across Canada, and really thrilled to be offering you some insight on return on investment and how you can make that case to your senior leaders for not only the tangible and intangible benefits that you've already identified in your leadership challenges, but also the financial impact that can help to get the attention of your senior leaders. So I'll ask, I forget who's advancing our slides. Thank you so much. So here's a little bit of an agenda for our morning together. We're going to give you an awful lot of information, but I'm going to start out helping to identify the problem that we're all dealing with, as well as some what's in it for me, some language there. I guess it didn't translate as well into French, but what the senior leaders want to know, what's in it for them when you're making the case for either investment or participation in your leadership challenges and your retention strategies. I'm going to share some insights that I gained while doing my MBA program in Ontario and focusing on a service provider organization that had high turnover before the pandemic, and identify why these retention solutions are where the money is at. But it's not just up to the HR team, it's everyone's responsibility. Then Suzanne's going to move into the ROI methodology. She'll show you her amazing 12-step evaluation framework, which I think has already been provided to everyone. And we'll talk about demanding more from your strategy, so you can cross that finish line. We'll offer a couple of the case studies examples, use some information from your own innovation challenge membership performance indicators that you've identified, and then show you how to do that grade 4 math on the ROI calculation. So it should make for a very interesting conversation. We'll have time for questions at the end. So if you could advance to the next slide. So you guys know this problem. It's been around for a long, long time. The World Health Organization identified back in, oops, I have a pop-up. Identified this challenge back in 2009, that we were going to be facing a global shortage of healthcare workers. Back then in 2009, they were predicting 15 million more healthcare workers needed by 2020. And since then, living in Ontario for 10 years, we've certainly heard an awful lot about hallway medicine and ALC rates. COVID-19, whoops. COVID-19 hit us, and now we were facing not only the trying to get back after the pandemic, but great resignation is occurring, burnout across all sectors, all regions. Agencies or organizations are turning to agencies, and travel nursing costs are skyrocketing. That we've become kind of an unsustainable problem. So I would like to argue that this HHR challenge is bigger than COVID. We've been dealing with it for a lot longer, but it certainly hasn't got the attention that COVID has. If you Google HHR crisis now, you get over 528 million hits on the internet. So people are paying attention to this problem. Now you can move to the next slide there. So as we all know, our healthcare system is in crisis. And my, Colleen mentioned at the beginning that I had over 20 years of experience with the Ministry of Finance. I'm now with the Ministry of Health in Saskatchewan, and I still run my own consulting company on the side, which is why I'm here with you today. This challenge is so big. I find time for it on my vacation days to help coach people who are focusing on this challenge. As we know, healthcare budgets are the biggest across Canada, and the largest percentage of that budget is our labor. So salaries for doctors, nurses, continuing care aides, personal support workers. There's a huge amount of labor being spent in the healthcare system. And organizations are struggling. We're constantly in crisis management, cutbacks, we can't afford training or raising wages. This problem has become even more wicked with the result of COVID. But as Susan and I will tell you, we're tired of talking about the problem. It's time to act. So we're very encouraged to see, there's 126 teams in this innovation challenge focusing primarily on retention. It's pretty exciting. So where does the problem land? Is it with governments? Is it with your CEO? Is it with your human resource team? It really is everyone's responsibility. We all need to take part in this, but it really does require a shift in our thinking about our people as an investment. We like to use this analogy of a boat because everyone's talking about recruitment. Everyone's stealing from one another. Poaching, I guess, is a term that we use as well. There's international recruitment. We're talking about incentives to have more grads in the system to attract people into the roles. And yes, we do need to fill these roles. Recruitment is important. But as Suzanne and I like to say, there's a hole in this boat. So there's really no point recruiting into our organizations if we have a toxic culture or if we can't retain our staff. Many of you know about the quadruple aim, the need to focus on our satisfied providers. So as we know, we can't just think about the quality and the financial and trying to find ways to satisfy our patients. We need to really focus on helping to satisfy our providers as well. And this comes down to focusing on our culture, our leadership skills. And today we're going to talk about how we can build your capability for talking about return on investment, because that is a unique skill that not too many people are talking about. So why should leadership care? The bottom line is, money talks, and this is one way of getting their attention. I'm going to share with you a little bit of data from a case study, a research project that I did back when I was living in Ontario, working with one service provider organization that had about 5,000 staff across Ontario, and I think it was 14 LHINs at the time. And so we reviewed the data to say what is happening in this particular organization. And so you can see all those little red boxes. You probably can't read the numbers because it's pretty small. But anything with a red box was a turnover of 50% or greater. The orange were 15 to 49%, and the white were below 15%, which is still a pretty high turnover, honestly. But we looked at the data and we said, okay, what kind of professions are leaving? How many people each year in this organization? So if you zoom in on nurses there, for example, nurse managers, there were 10 that left. Those are expensive. RPNs, 70 left over that year. 966 community support workers or personal support workers in Ontario, continuing care aides in Saskatchewan. Those are the people who are dealing with those that come home from the hospital. So across that whole organization, on average, it was about a 30% turnover rate. And this was before COVID. This was back in 2015. Next slide. So a question for you. We're going to have Bill pull up a poll. Do you know your organization's turnover rate? Just a quick little survey of everyone here online. Just a yes or no answer. Do you know your turnover rate? And then the next question is, what do you think it costs to replace a nurse? And there's a range. I think there's 5 options there. Under 10,000, 10 to 20, 20 to 50, 50 to 75,000, or over 75,000. And then the last question, some of you guys are really fast. Do you think anyone in your organization has quantified the cost of turnover? I suspect, because we're dealing with a lot of organizations here who are paying attention to this, our numbers will be higher on this workshop than we normally experience. Hey, Suzanne. But we'll see what the results end up. So I can see the results on my screen. I think 78% of you have participated. That's pretty good. We'll maybe give another couple of seconds for people to answer. Once we get to 80, maybe we'll close it. One more person. Okay, so it looks like we have about a 40-60 split, with the majority saying no, they don't know the organization's turnover rate. Looks like the majority think it costs between $20,000 and $50,000 to hire or to replace a nurse. Kind of a typical bell curve on that question. And the third question, do you think anyone's quantified? Again, about a 40-60 split, with 60% saying no. So thank you, Bill, for running that poll. We'll go to the next slide. So my aha moment when I was working on my Rotman MBA is no one is talking about turnover and no one is calculating the cost. So you guys, 40% of you, thankfully, are better than most because you are aware and you're calculating the cost and you're thinking about it. So if we can go to the next slide. We want to help to explain why is this so expensive. So as I mentioned, this was a high turnover rate before COVID, and now it must be even higher. We've got many organizations hiring agency and travel nurses. We need labor to fill those shifts, but it's really unfair to those existing staff who have, nurses coming in and working at 2 or 3 times the salary with less experience. And so that's contributing to the problem. People are feeling maybe resentful and being treated unfairly. So we're having more people leave. Back during COVID, the Registered Nurses Association of Ontario released a survey that said their typical loss rate is about 4.8%. During COVID, they found it to be closer to 16%. McKinsey's released a report recently. I've included a link in there for you if you want to check it out. Their hospital and staff RN turnover was about 18% in 2020 to 27% in 2021. Oops, can we go back to that previous slide? Yeah. So the question is, what is your turnover rate in your hospital? This is happening in long-term care and pharmacy. What is the impact on your team across all settings, all occupations? So there's 2 variables that go into this cost. It's the turnover rate that we've described and the replacement cost, which we'll talk about on the next slide. Okay, there we go. So the replacement cost, as you know, some turnover is normal. People retire, they have promotions, they leave. It's the voluntary loss or the regrettable loss that we care about. People who are leaving after their first shift or after they haven't really become fully engaged in the organization. So when does turnover become churn? And, as I showed in that case study with that service provider organization, many were leaving within 30 days. So there were some red flags there and some real expensive turnover. Not only is this causing stress at all levels, it starts to create a toxic work culture where you have trouble attracting people to your organization. So the replacement cost, Gallup has provided some information on this. They say it's approximately 1.5 to 2 times the salary. The Canadian Nurses Association pegs it at about 1.2 times the annual salary cost. Some say it's $75,000 for a nurse. We've had one CEO tell us that the cost to replace a senior leader in healthcare is about $250,000. So why is it so expensive? There's a whole list of direct and indirect costs associated with it. I didn't include that slide for you, but when you think about, the cost to create an ad and to sit in interviews and to, do the reference checks and to have your team, not just your HR leader, write the year for somebody to get up to speed and to be fully productive in their job. Meanwhile, you've got, stress on the organization, increased absenteeism, burnout, reputational risk. So all of these really, really expensive things factor into this cost of replacement. Next slide, please. So we know that it is high. And we know that some of this is important. We need to replace people who've left. But when it gets to be, repetitive over and over, we start to wonder, what can we do about it? And so, if you're going to do a calculation, you're not going to say, okay, I had 200 nurses leaving at $75,000 per nurse. You could, but that number would be high. What source can we use that's a really credible source of information? So the next slide, I'll introduce you to the Work Institute. They've done some pretty interesting things on this notion of turnover and retention. And so their 2020 retention report has a small, simple calculation there. It says, what does your turnover cost? So how many people quit in 2019 or whatever year? Multiply it by $15,000. This is a US company, so they would be saying by $15,000 US. And that's your annual turnover cost every year. So it's a pretty simple calculation. And they recommend this conservative estimate of $15,000. And Suzanne will talk about credibility in the information that we provide so that you don't scare people with this really, really large number. As it is using $15,000, the numbers get pretty big. And I'll demonstrate that in the next slide. So back to the case study, those 5,000 employees with 30% average turnover rate back in 2015. That's 1,500 people leaving that organization every year. And if we say the cost of replacement is this Work Institute $15,000 per employee, that's $22.5 million. At the time, I was working in one LIN, Community Care Access Center, a local health integration network, and there were 14 of them at the time. And there were about 20 of these organizations that I was dealing with in that LIN region. So if you said if that one service provider was losing $22.5 million every year, and I had 20 organizations that were dealing with the same problem times 14 LINs, that adds up to $6.3 billion. And it's pretty scary math, but I invite you to use your phone calculator and check it out. That's a very large number. And as I mentioned, this organization was not quantifying this cost. This was money leaking out of the bottom line without their knowledge. So yeah, that's the right slide. The woman freaking out looking at her bill. That's what I would love everyone to think about on that next slide. It's like your big cell phone bill. You're driving, you're taking a trip across Canada, and your kids in the back seat with their iPads, and they're watching a movie, and the data charges are scrolling and scrolling. If you were to get a bill at the end of the month, for $10,000, you'd freak out. You'd call that cell phone company. You'd demand a reversal. You would do something about it. But yet, this is happening in our work budgets, and nobody's really paying attention to it. So I just want to really impress upon you how important it is. And I know some of you are saying, well, these are soft green dollars and not dark green dollars. It's true. But if I said to this service provider organization, what would you do with $22.5 million every year? We'd increase wages. We'd have, opportunity to train our staff. We would retain everyone. We'd become the service provider of choice. But yet this money is leaking out of the organization through a bloated HR budget, spending things on agencies and interviews and all these important costs. And so anyway, it's not visible to anyone. The next slide, I think the Work Institute. Oh, maybe I took it out. I tried to reduce the number of slides. Anyway, the case is we have an opportunity to save some big dollars and to get CEOs and CFOs attention to show some big impact on the bottom line. And so we're going to go through and show you this tangible financial impact, but there's also a lot of intangibles that we're going to go through as well. So the point is to get our finance teams and our HR teams talking to one another and seeing the value of those people, working in their roles and not losing them. And next slide, please. So a couple of things you guys are talking about in your innovation challenges. You're talking about turnover, joy in work, some of those things. So I would really encourage you to take a look at your employee engagement surveys and to say, what is that information telling you? I would argue, don't do one more survey until you've looked at the data and shared and communicated what has happened in your last survey. It'll give you some really good indications on how you could retain staff. And stay interviews, another really important feature. Don't wait for people to leave. Wait, or have a conversation with them before they're getting burnt out and wanting to leave. Those are called stay interviews. And I'd really encourage you to make that part of your regular huddles and conversations. And brainstorm solutions with your teams because they know the challenges. I understand there's the nursing toolkit is being released soon. There's organizations who are telling us what they need, and it comes down to what does your local team need in your organization. You can learn from others, but it's best to ask your teams directly. Next slide. So this is an expensive problem, but it's not inevitable. The Gallup Research Institute tells us that 52% of voluntarily leaving employees say that their manager organization could have prevented them from leaving if they just talked to them. The Registered Nurses Association had done a survey a few years ago. Some of their recommendations were develop a retention strategy, do some workforce planning, but then it came down to really specific things, mentoring, mental health supports, childcare, succession planning, opportunities for growth. These are things that really matter to people, and we can make the case for investment in them. And the next slide. So I would argue we were looking at one particular indicator that you want to factor into. This problem deserves a people strategy. We've got a great resignation happening, but this could be our great awakening if we get people thinking differently about our people. There's a new focus on wellness, on resiliency, on flexible and remote work. People are demanding more from their job and they're leaving if they're not getting it. So it really is our imperative to start thinking about this as organizations. How can we build strong leaders, better cultures, and reform our workplaces to be that modern place where people want to be? So in order to elevate our people strategies, we really need to get the attention of the senior leadership suite and put some resources to it. Next slide. So I will turn it over to Suzanne, who will take you on a journey into the ROI world.
Well, thanks, Raylene. And some of those people strategies and ways to increase retention and reduce turnover, they're all scattered through your initiatives that you're working on for this challenge. So hats off to you right away that you're tackling this, some in small ways, some in faster ways, but you're hitting on all the right cylinders to start affecting this problem and turning it around. So again, hats off to you. So an introduction to ROI. ROI is return on investment. If some of you don't know that acronym, that's what it is. We're going to go through it very quickly. Oh, it's asking me to confirm my speaking language. English. Sorry. We're going to go through this at a very high level. It's a process, a framework that we apply and users of our methodology in healthcare in Canada apply in initiatives, improvement initiatives, HR initiatives on a continual basis to show the value and impact and ROI of those investments. And you can learn how to do this and build capability in your organization to bring this into the organization as a decision tool. So proving the value of your initiative and developing a full success story is something that I want to emphasize to you between now and when you have to submit on February 8th to the executive suite to get buy-in of your initiative. Showing the value, forecasting ROI is something that gets their attention. I'll get into a little bit more on that in a few more slides. But hope can't be a strategy anymore. We can hope that this will get better, and we need hope to make it better, this HHR crisis we're in. But we can't put something in place and hope it works. I'm hoping what I share with you today will give you a strategy to put something in place, to put together something that will show the value, or at least forecast it in the beginning, and not just hoping it works. It's a process improvement methodology as well. It'll highlight where your initiative is failing or is weak, maybe needs some tweaking. We look at 12 easy steps, and I can refer you to that now on page 4 of that handout you received. And ROI is the ultimate measure. Hey, we're called the ROI Institute, and we're called that because it is the ultimate measure. But I do want to focus, or you to focus on, that there's other levels of data that are critical to the success of your program. Yes, ROI is the ultimate one. It compares the cost of your initiative to the financial benefits that your initiative is bringing to the organization. So impact from an initiative, as Raylene indicated, includes non-financial measures as well. And we can move to the next slide. In addition to that return on investment, we have non-financial benefits that come out of our initiatives. And we'll talk to that a little bit today, and I want you to focus on those as well. Because in healthcare, sometimes those are more impactful than the financial impact. And we can move to the next slide. So what is ROI? I mentioned earlier, it is the ultimate measure. Defined, it compares the cost of a solution to its monetary benefits. You will see the methodology, 12 steps. It does provide a robust, credible process to get us there, to get us from coming up with the initiative, the right solution, gathering the data, converting it to monetary values, isolating our initiative to the impact measure that we improved, and coming up with an ROI calculation. We can move on to the next slide. Why is this important? Well, I have a little analogy that I share with everybody that if a tree falls in the forest and there's no one around to hear it, does it make a sound? We've all heard this. Well, I align that to the work you're doing. If you do or implement an initiative to reduce turnover, increase retention, if you have no credible way to prove that it did that, created that impact, made that improvement, and maybe generated an ROI positive, does it really have any? If we can't prove that, does it really have that value? So that's something to think about. So I sent, Health Excellence Canada sent you our guide, our application guide, we call it, the 12 easy steps. I'm going to refer to it very briefly together today. I already did on page 4 to see the methodology. We can move to the next slide. And I'll refer to it as we move along to a few other pages. So that first step in this methodology is start with why. Why are we doing this? Why are we putting this initiative in place? Why are we investing money in this program or this improvement initiative? In your situation, this is your why, your turnover rate, your replacement cost, and your absenteeism rate, possibly, as Raylene discussed, can be very, very expensive. Worthwhile investment. We can move to the next slide. So we want to demand more when we talk about picking a solution, spending money. I had a chief of staff in Ottawa tell me that they spend over $500,000 on leadership development. This is pre-COVID. And he said, we have no idea if it made a difference. We know we spent the money. We know the physician engagement, liked it and enjoyed it, but we have no idea if it made a difference. And continue to the next slide. So that's when Raylene says, let's cross the finish line. And that's where I want you to go with your initiatives, is to be able to prove it made a difference. So demanding more, we need to have a common approach to our solutions and build an evaluation system into it. Raylene's expression that I've stolen from hers, don't trip before the finish line. And that means build an evaluation process into your solution so that you can show that you cross the finish line with success. And ROI is definitely great for math. You need to know how to multiply and divide. So that demystifies that big mystery some people have around calculating a return on investment. So this just lets you set up something and build it into your initiative to ensure your results are achieved. What results do you want to see? Did we achieve them? And there's the model on the screen that you see on your page 4. You'll see the 12 steps. I'm not going to teach those 12 steps today, but we'll touch on them briefly and we can move to the next slide. So proving the value, impact, and ROI in healthcare, I like to say it has to happen. It has to come to this because of all the great work we do, all of you, and all of our healthcare professionals, we need money to do it. So we have to move from the place of not talking about money and maybe return on investment to that, because we do need money to do it. And we want the money being put into the right places in our healthcare systems, in our hospitals, that are giving us good healthcare outcomes, as well as saving the system some money. And there's so many of them being implemented today, and some of the ones you're implementing will do the same. If we can show the healthcare outcomes improving, and we can actually say retention is improving, but then in addition to that say, and here's the financial impact of that, that elevates your initiative to an investment versus maybe being perceived as a cost to the organization. Okay, we can move on. So we talk about a chain of impact. For any initiative to be successful, it has to follow this chain of impact. And I'll very briefly go through it, and you'll see it applied in an example in a minute. The reaction is that first link. We need a positive reaction to our initiative from all involved, from senior leadership right down to the people that are going to be implementing it and using within the organization the new program, the new process, whatever it is that we're implementing. If we don't have a good high level of reaction to it before we even roll it out, we've just introduced it, we can probably say that we're set up to not be so successful. So that's a really critical piece of data to explore. And that moves us to learning. If we're putting something new in place, a new initiative, some of your innovative ideas to increase retention, there's a learning component in there. And we have to have data to support our initiative that the learning was successful. People actually know what to do differently, what changes in behavior are required, what new processes are we implementing. They need to know. And then we move to where the rubber hits the road. Are they actually using the new process, the new system, using the components of your retention innovative ideas, implementing them in the workplace so that we can skip over the isolate the effects line, so that we can affect and create impact. Without applying our new initiative to the level we expect it to be applied, we cannot expect to see any impact. So we need data around application and implementation. Are people using it? How frequently are they using it to create the impact we're looking for? And that's why that critical measure that was asked of you of your innovative program for this challenge is critical. That's your impact. What impact is going to be generated if people see our program and are excited about it, they learn it, they start using it, applying it, creating the impact we're looking for. And that impact can be tangible or intangible. If it's tangible, we can convert it to a monetary value and calculate ROI. If we can't get a tangible or a number around it, we leave it as intangible. But as I said, those intangible benefits resulting from some of your programs are as valuable as the financial. Now that bracket there, isolate the effects of the program. Quick example is if you see 6 months after your program is implemented, a reduction in turnover, how much of that reduction in turnover essentially is attributable to your program? That's what isolating the effects of the program means. And that gives you so much credibility with your executive suite, that you're not stealing the whole pie, because there's many, many, many initiatives going on to solve this huge problem within our healthcare organizations and systems. So isolating is key. Okay, we can move on. So this 12-step methodology, just very quickly, I'm going to quickly go through an example. In step 1, in the first phase of planning the evaluation, is start with why. In this organization, nurse absenteeism was costing $10,000 a month. Any organization you're in can calculate the numerical value of absenteeism. HR or finance know those numbers. So then it's to select the right solution, do a robust needs analysis. Why is this happening? And then I'll show you what we mean by plan for results, and we can move to the next slide. So this example was a hospital. Their impact, their business need, the problem they had was unplanned nurse absenteeism was 9%, benchmark is 5%. Why was this happening? Their needs analysis determined that discussions between nurse managers and nurses are not occurring when there's an unplanned absence. If I take Thursdays off and nobody's asking me why, I'll continue to take Thursdays off as a possible example. So why weren't those discussions happening? The needs analysis determined that there was a deficiency in discussion and counseling skills. The nurse managers just didn't decide not to do it. They weren't doing it frequently because they didn't know how. Sometimes it's a difficult conversation to have. So we see the problem, we see the learning need, we find the right solution to fill that gap. This was a one-day leadership session for the nurse managers to learn skills, to be able to have those discussions and counseling, have the skills to be able to do that successfully. Next slide. So moving into that after we've selected the right solution, expecting success. And this is where you want to look at your initiatives as well. What are the objectives? And we can go to the next slide. I'm going to show you the objectives that this organization set at that chain of impact. They wanted the reaction of the program to be 4 out of 5 on the need, practicality, and nurse managers' intent to use. They did a little survey to collect that data. Learning, nurse managers are able to demonstrate the use of the new acquired skills. That tells us that they now know how in a classroom setting. The application is we want nurse managers to do these counseling discussions 95% of our absentee situations. We can't expect 100, it'll never happen, but 95 is what we're shooting for. And the impact of a positive reaction and learning new skills and applying them, we expect to see a reduction in absenteeism to 5% in 6 months. We can go to the next slide. So we need to collect data around that. The interesting part about those objectives set at those levels, we now know what data we need to go look for. And sometimes in our initiatives and programs that we implement, that data collection becomes cumbersome. Nobody knows what data we need, how to get it. But those objectives set us up for a good data collection. At levels 1, reaction 2, learning, 3, application, and impact, level 4. Okay, we can move on. So data collection, very quickly, you're going to get copies of this, and there's more detail in that guide that we sent you. But the typical instruments that we use and you use to collect this data that we need to show the success story of our initiative. Surveys, tests, questionnaires, interviews, focus group. Performance records in your situation with turnover and retention. That's your impact data source. We get a benchmark. What is our turnover rate now? Raylyn was getting some data on that from you. 60% said that they don't know the turnover rate in the organization. I strongly suggest that if we're putting an initiative in place and spending money on it to improve retention and turnover, we should know what it is. So that's something maybe you need to get before you try to evaluate your initiative to show an improvement in retention and turnover. Next slide. So making it credible is our next phase in this 12-step methodology. We call it analyzing data, but making it credible. A couple of steps in there to make it credible is we isolate the effects, as I referred to earlier. How much did our initiative impact the reduction in turnover or increase in retention? Do we have any data items, and we sure do if we reduce turnover, that we can convert to a monetary value? That's an easy one to convert. Calculate the costs of this initiative, fully load those costs, put everything in there, calculate ROI. And if we can't convert to a monetary value of those benefits, leave them as intangible. We can go to the next slide. So isolating the effects of the program is taking our piece of the pie out of the impact measure that improved. We can go to the next slide. How do we do that? There's multiple techniques that we use to isolate the impact. The control group arrangement is ideal. If we put this initiative in place in one part of our organization or in one hospital and maybe a family of hospitals as a pilot, we can then compare the improvement in retention in that group to a group that did not receive the program yet. Trend line, if it's trending down or trending up, if turnover is trending up and we have nothing else in place to improve it, we could use a trend, but that typically doesn't happen with retention and turnover these days because everybody's putting things in place. Those are the two most credible methods, if we can use them. And if not, we go into getting some credible estimates of the program's impact. We can go to the next slide. So this is an example case study template, I guess I can refer to it as that, where you can actually use this for your initiative. And I'll show you a live example of that on page, sorry, I'll show it to you on a screen in a minute, but it appears on page 22 of that handout that you were sent. And we can go to the next slide and we can speak to that. Essentially what it is getting those employee turnover reduction and absenteeism reduction in this situation converted to a monetary value. And that can be done quite easily in any of your organizations. And then we want to highlight the program costs. This program was a customer care center program. The cost to put this whole program together, including participants' time, was $222,000. And you can see that the benefits, the monetary benefits, were $436,000. And we can go to the next slide. If we compare those costs to the benefits, the monetary benefits, we get a benefit cost ratio where it says if we invest $1, for every dollar we invest, we have $1.96 in benefits. But the ultimate measure is for every dollar we invested, we get 96 cents back after the costs are recovered. Hence, that's an example of calculating an ROI on your initiative. Those steps in the evaluation will get us to those numbers to be able to calculate that. Now we have intangible measures.
Sorry, Suzanne. I'm just going to interrupt you for 1 second. Do you mind going back? Because I think that's a really important, you talk about the benefit cost ratio, and then the ROI calculation is a slightly different twist on the benefit cost. Do you mind just explaining that?
Sure. Thank you. The benefit cost ratio is comparing the program benefits, the monetary benefits, that $436,000, to the costs. And that's a government calculation. It's used quite a bit. And defined is for every dollar we put in this program, we're going to see $1.96 in benefits. Now, pushing it to express it as an ROI, as a percentage, it basically is that same calculation, taking the costs out of the benefits and doing the division to come up with 96%. And those of you with high grade 4 math can see that if you did the benefit cost ratio, that quick division, 1.96 to 1, if you subtract 1 from the 1.96, you can say 96%. Gets you there a little quicker. They're sisters and brothers to each other, those calculations. Some people, when they're presenting their evaluations, like to show both.
Okay. And just thanks, Suzanne, for clarifying that. And just on this slide, this is the example from page 22 in the guide. But if you go to the previous slide, it's a blank template where you can use all of your data. You know, if you want to see a reduction in burnout or turnover, you know, what are your numbers? What is the benefit of that? And then what is the cost of your particular initiative? You can put all those inputs in there to get the total cost of the initiative and then do the calculation. So just wanted to help clarify that.
Good. Thank you, Raylan. Okay, we can move on. Next slide. So that's the monetary benefits of this example on page 22. But in addition to that, there's typically several intangible, non-monetary benefits that followed of any program or initiative that's trying to improve retention, reduce turnover, because you're putting people strategies, as Raylene referred to, in place. And they affect a lot of benefits, not just the reduction in turnover, which is monetary, or reduction in absenteeism, which is monetary, but it affects burnout, lower stress, more compassion, empathy, higher self-awareness. I see a lot of initiatives being put in place in this challenge that focus around safety, which is a very high monetary value as well. You can convert any safety issue to a monetary value quite easily. But if we put a safety program in place, we see multitudes of intangible benefits that fall out of that as well. And I suggest to you in any of your initiatives to identify what those intangible benefits are, what intangible measures will improve as a result of your initiative. And I will show you, flip around here on page 20. Get there. Sorry. My book printed out with the wrong page numbers. On page 20 of that handout, you can see in the center of that, connecting the intangibles to the program as an example on how you can collect data to credibly support the improvement of your intangible measures as a result of your program. Okay, we can go to the next slide. And the back end of those 12 steps is really critical for your challenge right now, is to tell the story. You need to communicate the results to key stakeholders. And I suggest now what you're looking at is getting a forecast together on what it would look like if this got implemented. Get some estimates on the dollar value of your improvement. Put a good cost list together of the cost of your program and do a forecast and communicate the whole story to your executives. Gets their attention. And then our last step, and we can talk to you at another time if you want more information, is optimizing the results using black box thinking. That's using this process as a process improvement. What did we do right? What did we do wrong? How can we make it better? We can go to the next slide. So my little example that I shared with you on that absenteeism costing $10,000 a month, this is something that you might want to put together in your presentation to executives as part of it, as a forecast, or maybe collect some of this data before. This one was that they had at level 1, they had high levels of people saying that, yes, it's relevant, important, and we intend to use it. Those nurse managers gave that data back. Learning objectives were met in the communication skills and counseling skills. Application, we did have data collected around the application of these skills, and they were being used to 95% or more of the time there was an absentee. The impact, they reduced it to 4.5 in 6 months. They didn't meet their 5, but 4.5 delivered a monetary value of $60,000 annually, saved to the organization. And in addition, they had those intangibles. They had an increase in engagement and teamwork and a reduction in stress. And then we calculated ROI. The cost to run this program for this group of nurse managers was $25,000, delivering an ROI of 140%. So that's just giving you an idea of where you can go with this and the data you can present that really does get executive attention. We can go to the next slide. And I just very, very briefly focus to tell you that when we use this methodology, and on page 21 you can see them, we have 12 guiding principles that keep this method credible, conservative, and consistent, where we can compare different initiatives to different initiatives using the same process. And we can move to the next slide. Perception and reality, and this is where I wanted you to take your initiatives and you're in this challenge to be perceived as not a cost, but as an investment. If we want to invest $222,000 in that example we saw, that's hard to speak to. We're asking for $222,000 that maybe doesn't exist or we don't have because it's perceived as another cost. Costs are controlled, costs are reduced, costs are eliminated, or perceived as a cost aren't funded. So the consequence of that is you lose your support, your funding is curtailed, your influences around this initiative are diminished because it's perceived as a cost. Using this process, you can present it as an investment in the organization. Not only are we going to keep our nurses, keep our healthcare professionals, we're actually going to save the system money by investing that $222,000. So investments, things that are perceived as investments, they're maintained, they're enhanced and protected. If you can have a program that's actually saving the system money and reducing burnout, reducing stress, keeping healthcare professionals, they want to maintain it, enhance it, and protect it, and continue to fund it. You earn a seat at the table when we start talking about funding, client relationships improve, and your program is an investment in the organization and not a cost that could be cut. Okay, we can move to the next slide. So your challenge, and I think I'm going to let Raylene take over from here, is that February 8th date to speak to senior leadership or present to them. But beyond the challenges where Raylene's going to speak to is how will you advance, implement, put in place, continue, get funding for your innovations. Raylene, I'll let you speak to this.
Sure. Thank you, Suzanne. And I love Liliana's comment that this should be part of any business plan and project proposal template. High five to you, Liliana, my good friend from Ontario and Saskatchewan, Chief Nursing Officer here in the Ministry of Health. So what we're going to present to you today is a template that you can use both for this challenge on February 8th, although you'll have a template that Bill will share with you that you need to use that specific template. But the template that we'll share here is just a simple business case example that you can use to build the case, including this financial argument, the ROI, for the innovation challenge and then beyond, because this problem isn't going to go away with your one primary indicator that you've identified. This problem is a crisis, and we're going to need everyone putting all resources and energy towards it, saying these are the multitude of things that we need to actually retain and engage and build back our workforce. So here we're going to give you on the next slide a little template for you to use to do this business case. So it's just like a simple briefing note, you know, senior leaders want 2 pages, 2 to 5 pages. So we're suggesting 2 pages plus appendices. Your first item would be to identify the issue, the business problem, the burning platform. And that's why we present to you the what's in it for me, the financial imperative. Turnover is costing our organization X every year. That's money we could be using to spend on other things. You might want to identify a couple different options you're considering. You're talking about safety, you're talking about joy in work, burnout, retention rate, reduced recording, using AI tools and stuff to reduce the administrative burden. So you might have a multitude of ideas, pick your best, do your analysis. And obviously in healthcare, we have to consider clinical implications as well as operational, financial. Identify the tangible financial benefit. This ROI calculation will be unique to most senior leaders. You can talk about your impact on your primary indicator. What do you hope to achieve in 6 months? Maybe you roll it out to half of your nursing team. see how it goes, evaluate, do it to your other half or do it with your other half after 6 months. So within a year, you might be hoping to chip away at that high turnover rate and retain your staff. You really need to build evaluation into your process, as Suzanne has identified. How will you know if you're making a difference? So I wanted to share one quick example. We were working with a hospital in Ontario who, during COVID, identified burnout in staff because all the mental health conversations that supervisors need to be having with their teams, and the supervisors felt very, very ill prepared, nervous to have these essentially mental health conversations with their team. So the hospital, rightly so, reacted quickly. They brought in a team from CAMH to coach their supervisors on having these conversations. They could tell us how many people attended. They could tell us what it cost, whether they liked the speaker, whether they had a good lunch. But when we said, is it making a difference? Do your supervisors feel confident or more prepared? I don't know. So what if your CEO said, will we do it again? I don't know. People liked it. They had a good lunch. No, this is what I'm talking about, tripping before the finish line. If they need more coaching, they might need a script. They might need to be held accountable in their performance conversations. They might need to practice role play. Help them cross the finish line so you get to that behavior change. So this is why we say it's really important to know what you're trying to do. What is the measure? Coach and lead to behavior change. And Suzanne's nursing absenteeism is a great example because a lot of us are afraid to have those conversations. So ask your teams to do this 80%, 90% of the time. Try it, build a skill. If we can reduce absenteeism, we're going to save money. So that's the evaluation bit. The ROI calculation, as Suzanne has showed, is fairly simple math. And you need to fully load your costs. You need to be credible, all those things. And we're giving this to you at a very high level. So it's a lot of information. Choose your preferred solution. Moving on to that second half of that template. What's your recommendation? What do you believe in is going to have the greatest impact? Try it, test it, and then maybe 6 months from now you offer something new. But once you start talking about this language, this financial impact, you'll be excited to see how many things you can quantify, and then see if you can replicate it. Implementation plan, obviously senior leaders want to know when's it going to happen, the next steps, timelines. Talk about isolating your intervention so you can evaluate and see if it's had some impact, so you will know if you can recommend it again. And then obviously your appendices would be some of your background information, your schedules and communications plan. So this hopefully will be a template that you can use into the future as you're working beyond the innovation challenge. Next slide. So our call to action to you, I'm really pleased that at least 40% of you know about your turnover rate and they're starting to quantify it, but there's still 60% that you guys, I think you need to go and find some data. We have a simple calculation. The very last slide of the deck shows you how to calculate that turnover rate. If you can't do it for your whole organization, what about for your team? What about for the group that you're trying to impact? Sometimes it's tricky to gather this data. So estimate your savings and your benefit from the intervention. The next slide. Calculate the cost, calculate the forecasted ROI, share this information. This is a tremendous business case that will help shift the thinking in your organization, hopefully, to see people as an investment, not as a cost. And then the next slide. Help to prove the data, prove the value, the impact, and the ROI of your solution, and use your evaluation process to demonstrate, what you would do to adjust or repeat if you're finding it to be successful. And I think we're getting close to the end here. So I know we've given you a lot of information, and I talk fast. I feel sorry for those interpreters trying to translate this. Reach out. I'm signed up as a coach with the challenge. So is Suzanne now. We're going to be around to help answer some questions here for the next half hour, but also are available to help round out any understanding you might need. And we do, further coaching on this, workshops on ROI and resiliency and that kind of stuff. So let us help you build your people strategy. I think that's the last slide. There's a couple of, closing poll. I don't know if we want to do that just yet or we'll have questions first. But we will ask, we want to know if this is relevant and if you'll use it. So this is our important data to say, are we helping you get what you need? And then just to scroll to the other slides, there's some contact information for us. And there is that very final slide, which shows you how to do the ROI calculation. There it is there. So any questions, feel free to reach out. And I think we have gained an extra 5 minutes because we speak so fast.
Yeah.
Thank you so much, Raylan, Suzanne. A wealth of information, and really appreciate the demystifying, as you said, right? Because I know oftentimes when you think of ROI and when we're talking to different individuals and selling what is the impact of what we're doing, some want to see it more from that financial impact. Some might want to see it from other ways. So really appreciate the demystifying of that ROI and demonstrating the impact through there and giving the structures and tools for many teams to put it into practice. And I think, and tools not just for this innovation challenge, because we know, and that's the wonderful thing, is we are surrounded by folks that are committed and see the impact, the positive impact that retaining the current and supporting the workforce can yield. And I think, should teams be like, oh my goodness, this is too much for us, it also gives teams the ability as to, we can work together with our leadership saying, we need to lean into this. This is an investment, not a cost. Let's work together and demonstrate it and see that. So thank you so, so much. And absolutely, we've got times for questions here. I'm just going to scroll the chat. And so there is a question from Tara about the coaches, and Bill has mentioned that, is that we do have group coaching sessions scheduled for later this month, early January. And if you want to email the challenges inbox, we can make sure from the support team that we have organized. Absolutely, the templates, the recording will be shared with folks. Trying to see anything else here. Certainly, I think digesting a lot of information is what I'm seeing, Raylan and Suzanne, and wanting folks wanting to look through the ROI guide that has been shared. Oui, absolument. Sonia, on va partager les diapos avec tous les coordonnées aussi. And again, lots of appreciation and that. So, and Tara, we can certainly coordinate in what we can maybe do as related to your coaching meeting there. Chantal, I do see your hand up. Come on.
Hi, thanks for this. Is it okay to ask a question?
Absolutely.
Great. Thank you so much to you both for this great presentation. I'm Chantal Leclerc. I'm one of the coaches in the Extra program at Healthcare Excellence Canada. In calculating the ROI, I was wondering, how far do you advise that people go? So in the example that you gave on absenteeism, I can get that in terms of, these are tangible, these are direct costs, we can actually quantify that. Do you advise to push the analysis as far as we can go? So for example, we know that by reducing absenteeism, we might reduce an adverse event, right? If we prevent even one medication error, that's another cost. So is there sort of a phase 1 ROI? And if you were to add on any further analysis, do you suggest there's like a phase 2? This we know for sure. And then there's the potentially avoidable costs that you could add on to your ROI. So how far do you push it?
Well, that comes in your planning phase of when you're picking a solution and setting objectives, and what you're focusing on now are impact objectives. What is this program going to impact? We know it's going to affect positively absenteeism. And then, oh, hey, if we reduce absenteeism, we're also going to reduce some errors. We're going to increase quality. We're going to have all these other benefits that are going to come from it. I would put them all in if they're significant. If they're not significant, maybe put them in, but maybe not calculate them into a monetary value. But hey, if we're reducing absenteeism, and we have been doing so, we're reducing a lot of other costs to the organization, whether it's errors, quality, etc. Yeah, line them up, especially if you're going to the executives with your initiative and saying, this initiative is going to reduce turnover and absenteeism. But in addition, because of that, we know through research or within the organization that these other impacts are going to be effective in a positive way. Yeah.
Yeah, and let me add to that. Thank you, Chantal. It's an excellent question, because I think, when we talk about a people strategy, we're doing this for recruitment, we're doing this for culture, we're doing this for, leadership engagement, we're hoping to have increased patient safety and outcomes and satisfaction. So everything's kind of woven together into this great big mass. If we can isolate them and say, okay, we're going to spend the next 6 months on leadership development, and we're going to focus on these 10 leaders on this team because they've got a problem. And we're suggesting turnover, absenteeism, those hard financial things that have a financial impact. Isolate those. And then you might say, oh, we're going to have a potluck, or we're going to have an employee of the month, and we're going to do some things for culture. And at the end, you might, I don't know, what had an impact? You might have to survey your team and say, over the last 6 months, we did 5 things to help you improve in the workplace. We did leadership development, we had potlucks, we had employee of the month, we had heaters in the cold building. 5 things. What had the most impact on you? And then you'll have your team, and it's a little bit imprecise because it might say all of them, but you might have one person say, actually, childcare, or your flexibility or your eye contact was the main thing that impacted me. But all together, we're seeing these things. And so in the end, it doesn't matter as long as we keep our staff and they're happier and patients are safer. We might not know exactly what was that thing, but all those things together should have an impact. And so I think what we're trying to say is tangible, hard dollars, green dollars maybe, intangible, but together, the outcome is what we're trying to achieve.
Did that answer your question? Did that answer your question? Okay.
It did, yes, thank you.
I'll just I'll flip to an example. There was in the primary indicator section of all of your initiatives that we were presented. There was one in primary indicator that was quality improvement huddles. They wanted to increase the number of completed and implemented initiatives from those huddles. How many initiatives came out of the huddles? How many were implemented? They wanted to increase that. So I put my ROI hat on, and the ROI thinking hat, as I like to call it. And I say, think the next level with that example. Okay, we've increased the number of initiatives for quality improvement. Great. The next level is, what impact did those that we implemented have on the organization? We implemented A, B, and C. The costs of A was this, the B was this, the sub C was that. What impact did they generate for the organization? So that's an example of taking something like your original question. Yeah, we're going to reduce absenteeism, but hey, what other impacts were affected? That's where we want to start thinking about this further, because the more we can put together credibly and isolate credibly to our program, that just gives you more opportunity for more funding, continued funding. It just goes. I don't think an executive is going to get excited to hear that we had a huddle and we've increased our quality initiatives by 10% that we've implemented. They get excited by saying those 10% that we implemented have created this impact. So that's kind of the message we want to share with you today, is to take your initiatives. And I like to say in healthcare, I get a little bit of a pushback sometimes, but start looking for the money that you're saving with these initiatives. Not only are we improving quality care and quality or safety, what's that saving the organization? That gets everybody's attention.
Great question, Chantal, and thank you so much, Raylan and Suzanne, for that. We do have a few more in the chat. So a question from Dustin, certainly appreciation for the presentation. And just talking about the final slide that was shared, there's a calculation on turnover rate. And do you have, and if there's a suggested calculation for cost of turnover?
Yeah, I can take a crack at this, and Suzanne, welcome your insight as well. So
Yeah.
a lot of people talk about, what is a turnover rate? And so that last slide just shows it's sort of the average turnover, the head count in January and the head count in December, and then taking the average of the two. So for that RN position, there was 257 in January, 283 in December. It's the average, it was 270. 51 RNs departed. And so that is, 51 divided by the total 270 times 100 is 19% turnover. So that's the number, that's the rate. And so then we talked about, well, for that service provider organization that had 5,000 staff and a 0.3 or a 30% turnover rate, that was 1,500 people. So you take it down to, okay, in this one, there were 51 RNs who left. So what's the cost per employee? And so when we go back and we say, we asked you guys, what do you think? Is it under 10,000? Is it over 75,000? On average, you guys said somewhere between 50 and 75, I think was the number. Work Institute says 15,000. Keep it simple, keep it credible. So, 51 nurses times 15,000. I'll let you do the math, Dustin. And so I think, we don't want to be too scary with this number. Any dollar spent on this is a dollar we're not putting towards anything else, right? And so we want to keep those nurses, not have to replace them with brand new and have a high learning curve for the next year. All those costs that go into replacement. So I hope that answers the question.
Thanks, Raylin. And Dustin, feel free to jump on or just acknowledge in the chat. And I hope that addressed your question. Got a smiley face and thank you. And Dennis, one of our other coaches, also put a good comment there in the chat about that first time working through the ROI. It might seem a bit of a challenge, but maybe preparing for the ROI calculations is when you use that second project. I think to your example there, Suzanne, as pointed out, the math is simple and the data collection requires the most effort.
Yes, data collection and data analysis. And I also will emphasize that if you don't have those objectives set at the beginning, you don't know what data to collect, really. So setting those objectives is what impacts do we expect to see? That tells us what data we need, and even further, where do we want to get it, and even get sign off from people that need to provide it to you at the beginning. Eases out that data collection hurdle that we sometimes run into.
Great. I'm not seeing any more questions. And again, I know we have a poll to bring up. Once again, a huge thank you. And also to remind teams, this is one way we are, we wanted to provide this session, and Bill is going to come on momentarily and provide some guidance and some updates about the upcoming opportunities. And we just thought, as you're preparing, that this might be one way in positioning as part of that senior leadership engagement as well. So maybe we'll bring the slide back up. I think Raylin and Suzanne, there was a poll at the end of your presentation. And then what we'll do is we'll turn it over to Bill. Thanks, Sheena, for bringing those up.
Yeah, and I think Bill's going to launch a poll to ask these questions. Was the content presented today relevant? Do you intend to apply it? Do you believe being able to calculate and demonstrate the ROI on people's strategies would get the attention of your C-suite? And do you see value in building these skill sets for you and your team? Thank you for participating in that. It's good data for us. And we're always open to feedback on how we can present. This is a bit technical, but it's exciting. I think, when we talk to people about being able to have an impact on this crisis, it's energizing. So hopefully you feel some hope and you have a strategy, right, Suzanne? It's not just hope.
That's right. Yeah, hope can't be your strategy.
But it's a good place to start.
Absolutely.
As we like to say, evidence-informed hope, and that.
Exactly.
So yeah. So we'll take a few more minutes for the poll, and then Bill will get you to show those, and then over to you. And once again, thank you, Raylin and Suzanne.
Thank you.
Well, very resounding, and so thank you for the wonderful session. Over to you, Bill.
Thanks so much. And I know many people are starting to trickle off and get to their next commitments, but we wanted to provide a few updates and announcements, and you'll actually find these in your inbox in the next couple of days. So don't worry about that, but we want to present them on the webinar while we had the opportunity as well. So on the next slide, we will be sending you the recent award winners from the Dinosaur Challenge as well as the Impact Challenge. So those will be coming. The Impact Challenge, we will be getting out with individual announcements very shortly to let the teams know who won those awards. The upcoming deadline, as we've mentioned, for the Senior Leadership Engagement Mini Challenge, it's February 8th. And for the quarterly reporting too, those are for the months of October, November, and December on your outcomes and reach. It's going to be due January 31st, and those are put towards your eligibility for the larger midterm awards. We also have some exciting announcements. We're really, really excited that we have been able to increase the numbers of awards for a few of the upcoming opportunities. And that actually will increase the odds of you being able to take advantage of those opportunities. So we'll include a snapshot of the updated awards numbers in our email note. And we're also going to be sending out a calendar booking hold for a team celebration event that we're inviting you to join virtually on March 19th. And we hope to be able to bring teams together to share and celebrate. And we'll be also hosting the dinosaur pitch competition that follows on from that dinosaur challenge. So next slide. So the midterm progress awards, so as I mentioned, your quarterly reporting deadline is January 31st, and we'll be calculating the midterm retention progress awards based on your progress from baseline up to and including the data you report up to December 2023. And these are some of the larger awards available through the Innovation Challenge. So really encourage you to submit that data if you've got it available. And on the next slide, our Senior Leadership Engagement Plan awards. So teams are invited to submit a Senior Leadership Engagement Plan, and we'll be providing that template, which is also available on the online portal. And in the template, you identify strategies for engaging your senior leadership in different actions and practices that have resulted as part of the work undertaken through the challenge. And we hope today's session has served as some inspiration for you to complete that, potentially using ROI as part of your senior leadership engagement plan. And that is it for me. So as I said, stay tuned for all this information to come to your inbox very shortly, and really wonderful to see so many people able to join online today. So I'll hand it back to you, Colleen, for closing.
Thanks so much, Bill. And once again, thank you everyone for taking time out of your day. And thank you to all the teams, the coaches, the judges who are helping make support the teams and all the teamwork that you're doing in moving your innovation and the practice forward to retain and support the workforce. Thank you for the excellent and engaging discussion, Raylin and Suzanne, and we hope that everyone, and certainly sounds that it was well received, that this session was informative, and we commit to responding. And for any questions, post and connecting, and that we will be sending all the materials out in an email. And once again, we look forward to seeing you at the next event. And until then, all the best. Thanks.
Thank you.
Thank you.
Great to meet you, Colleen.